name is Dr. Michael Lenz. I'm a pediatrician, an internist, and a clinical lipidologist. I practice in Wisconsin in the Oconomowoc area. And I'd like to take some time with you to teach you about type 2 diabetes, in particular medication treatment for type 2 diabetes. When we look at treatment of type 2 diabetes, I want to first talk about what type 2 diabetes is. Type 2 diabetes is where your body doesn't make enough insulin and the insulin does not work as well. The problem with type 2 diabetes as opposed to type 1 diabetes, where your body doesn't have any insulin production because the immune system destroyed it, with type 2 diabetes it usually starts that insulin isn't working as well. Think of insulin as a key that opens a door. In your body, the doors that it's opening it up to are the liver and muscle cells, and also the fat cells to some degree. Insulin normally, as a key, can open the door. It goes in just fine. But with type 2 diabetes, think about it as somebody taking gum and putting it into the lock. So it's hard to get the key in, and it's also hard to turn the key. There's causes of this, but on a very basic level, we're understanding that there are byproducts of fat that affect this. They're called free fatty acids, and what they do is they gunk up the ability for insulin to work. That happens both in your diet as well as in your diet over time, that leads to increased abdominal fat both around the abdomen as well as around the organs in your midsection that increase the effect or decrease the effectiveness of how insulin works. When we look at the importance of treating type 2 diabetes, there's two benefits. One's called microvascular events. Those are looking at injury to the nerves, injury to the kidneys, decreased functioning of the immune system, as well as stimulating blood vessel growth in the retina of the eye that can lead to blindness. These don't usually directly cause the death of most people with type 2 diabetes. For most people with type 2 diabetes are what we call macrovascular events. Those are heart and stroke related events. When we look at treatment of type 2 diabetes, I'm going to go through the medications for treating it, and then we'll talk about an interesting paradox. When we look at A1C, the table here, the graph shows that as somebody's blood sugar goes up, and a way to measure somebody's average blood sugar is by the hemoglobin A1C, the risk of heart disease goes up. Normal is a hemoglobin A1C of less than 5.0. Diabetes is considered 6.5 or greater. If we have a fasting blood sugar of 126 or higher, that's considered in the diabetic range. If we have a blood sugar less than 90, that's considered normal. And anything between 90 and 126, fasting is connected with increased, what we call pre-diabetes, or on that whole spectrum as the graph shows here, with atherosclerosis, plaque developing over time. Looking at the medication for treating diabetes, there's sulfonylureas. Those are medicines that start with the GLP or GLIB prefix, such as glipizide or glyburide. These were the first oral medications to treat type 2 diabetes. They lower blood sugar by increasing the release of insulin from cells in the pancreas called beta cells. Unfortunately, these have not been shown to decrease the risk of cardiovascular events. They actually have been shown to double the risk of cardiovascular events compared to another medication called Forman. There are multiple reasons why this may occur, including weight gain. It also can potentially lead to hypoglycemia. Metformin is a medication that helps treat diabetes by lowering blood sugar. As with sulfonylureas, they lower hemoglobin A1C by about 1.5 depending on the dose. This typically is at the 1,000 milligrams twice a day dose. It also can cause some mild weight loss in the first couple years. Usually over time, though, the weight does come back. This does cause some abdominal cramping and some nausea initially. That usually goes away with time. We often start at a low dose and gradually over weeks increase the dose. There also is some concern in using this in patients who have significant heart or kidney problems. Insulin, of course, helps in lowering blood sugars in type 1 diabetes as well as in type 2 diabetes. There's multiple forms of insulin, both long-acting, once-a-day dosing, to types of insulin that try to mimic our normal release of insulin. These help lower blood sugar, and lowering blood sugar has been shown to decrease the rate of developing those microvascular complications. But it does cause weight gain in almost every patient that's on it, and it does not improve insulin resistance by itself. There are the glitazone medications. They work by improving the effectiveness of how well insulin works. Those are medicines called pioglitazone, brand name Actos. There's another medication called Avandia. The next group of medicines are called incretins. They are gut-derived factors that increase glucose-stimulated insulin secretion. These include what are called GLP-1 agonists, glucagon-like peptide agonists, and DPP-4 inhibitors. The GLP-1 inhibitors have the benefit of mild to moderate weight loss. This is likely through decreased stomach emptying and decreased appetite. The DPP-4 inhibitors cause less drop in blood sugar without significant weight loss. The hemoglobin A1C drop with the incretins, the GLP-1 agonists, are about 1.5 on the hemoglobin A1C scale, which is about a 40, 50, 60 point drop on a fasting blood sugar when we look at that. The GLP-1 agonists are a protein, so they need to be given as an injection, which can be done twice a day, and once weekly injections available now. In animal studies, it has some heart protection benefits. Ongoing heart protection studies in people are in progress here. Now, unfortunately, despite the increased risk of blood sugars going up, aggressive treatment of type 2 diabetes has not been shown in major studies to decrease the risk of cardiovascular events or mortality. For years, it was just assumed that if we lowered your blood sugar levels, you were going to have fewer heart attacks and fewer strokes. Early studies done with one of the sulfonylureas showed increased mortality, increased cardiovascular event rate, but this was discounted mainly due to ad hominem attacks. Many have said that if the study would have been done today, it would never have been approved. So here's the paradox when we look at diabetes. Glucose levels in high blood sugar states, known as hyperglycemic states, increase cardiovascular risk in a continuous manner. But the paradox is this: definitive evidence that improving glucose control decreases major cardiovascular events is missing. When we look at this, there's some futility in what do we do. Now we know it helps lower numbness in the feet, microvascular complications, and blindness. But that's frustrating. So what are the other options? On one extreme option, you can go to get gastric bypass surgery, and it's been found to be successful. But what do the studies show when we look at diet and the effect of diet in reducing diabetes and reversing diabetes? And interestingly, there are a lot of things that have been shown to be quite effective with diet. In particular, a low-fat, whole foods, plant-based diet. Now when we look at the causes I talked about earlier, it's insulin resistance from insulin not working well, not able to get into the lock, and not able to turn the lock because, in a sense, glue is gumming up the lock, because fat is interfering with how well insulin works. If we go on a low-fat, approximately 10% low-fat diet, insulin starts working. I had a patient recently, his blood sugars on diagnosis of diabetes were 240, eating a typical American diet. His blood sugars within a week went from fasting 240, 210 the next day, then 180, 150, 130, and 118 in a week, eating a completely low-fat, whole foods, plant-based diet where there's legumes, fruits, vegetables, and whole grains in unlimited, without any added fat, no dairy, and no meat. The studies done by Neil Barnard showed reduction in hemoglobin A1Cs, There's also been other multiple studies showing decreasing doses of insulin in people who have type 2 diabetes that have gone on a low-fat, whole foods, plant-based diet. There's also multiple studies looking at the risk of developing type 2 diabetes. In the Seventh-day Adventist trials, the risk of developing diabetes was markedly lower in those who had those who were eating a vegan diet compared to those who were eating a typical American diet. It was more than double, about 2.5 times the risk of developing diabetes. So if we're looking at trying to control type 2 diabetes, we want to lose weight, increase insulin effectiveness, and the diet can make a big difference when it comes to this. In addition to that, the Seventh-day Adventist study showed that men who had type 2 diabetes men who were eating a vegan diet lived 10 years longer than those who were eating a standard American diet. Besides treating the blood sugar level with type 2 diabetes, it's very important to lower your cholesterol and lower your blood pressure. Ideally, that's done through eating a low-fat, whole foods, plant-based diet. A low-fat, whole foods, plant-based diet has been shown to lower cholesterol between 20 to 40%. It also has been shown to lower blood pressure about 10 to 20 points. For those of you who, despite eating a low-fat, whole foods, plant-based diet, still are not able to get your cholesterol levels in a safe range, or if you're not able to follow the diet and adhere to it completely, medication can be very effective in lowering your risk of having a heart attack or stroke. The statin medications have the best track record for lowering risk. They generally lower risk about equal to the percent reduction in the cholesterol. The average cholesterol lowering medication lowers the risk by about 40%, 30 to 40%, some over 50%. Also, lowering blood pressure is very important. Medications to treat blood pressure often are indicated and help lower the risk of having a heart attack or stroke. I hope these are effective. This is not meant to replace a discussion with your doctor, but hopefully education both for my patients and for patients out there trying to get more information on type 2 diabetes. To summarize, treatment of type 2 diabetes lowers the risk of developing microvascular complication, injury to the nerves, the kidneys, the eyes, and immune system problems, as well as dehydration from very high blood sugar levels. Treatment with medications has never been shown to lower the risk of you having a heart attack or stroke, which is the #1 cause of death in those who have type 2 diabetes. Treatment with a low-fat, whole foods, plant-based diet has been shown to both lower weight, increase the effectiveness of insulin, decreasing the dose of insulin that patients patients who are on insulin with type 2 diabetes. This type 1 diabetics still need to be on insulin because they do not make any insulin at all.